Well, nurses have been caring for their COVID-19 patients, but the question now, who is taking care of them? A recent survey of healthcare workers showed that more than half showed signs of depression, and almost 2/3 reported feeling like they had no control over their lives. News 4's Jen Maxfield reports on how the mental health impact of this crisis may last far longer than the virus itself.
Avra Messe was still in nursing school at Columbia when she started caring for COVID-19 patients.
It was hard to come home with all of those feelings of having so many patients die per day.
To cope with the stress and anxiety of being on the front lines of the pandemic, Messe used her hands for another reason, sewing masks and making clay cups with rainbows for fellow healthcare workers.
When I make pots, it's my touch. And when someone drinks from my cup, they're drinking from something that I've made and formed with my hands.
More than 3 months into the pandemic, the strain of working long shifts and worrying about their own health has worn on many nurses.
We carry that trauma, emotional, mental trauma of feeling, did we do enough? Could I have done differently?
Columbia Nursing has formed circles of care, Zoom support groups where nurses can lean on each other with guidance like this.
How do you take a moment to remember who you are and what brings you joy? Are you eating well? Are you trying to sleep?
I think that human connection is the thing that we are all needing right now, and considering we've been in isolation for so long.
Dohrn says the overwhelming support from the community does help. Baked goods and meals for nurses, and of course, the nightly 7 o'clock show of support for healthcare workers. But long after the applause has faded, nurses will need time to heal. Jen Maxfield, News 4 New York.
Oh, that's great. All right, our cooler